Hi, this is Dr. Nucci for Nucci Medical. Welcome to Back in Focus, straight talk for a healthy spine. Today I wanted to talk about laser procedures for the neck and back, for injuries to the neck and back and chronic neck and back pain. In the neck and back, there are lots of small joints, one on top of the other. And I actually have a model here that shows the joints. This is a model of the low back. These are the bones of the back, and these are the discs, which are the cushions. And the spine will move and bend, and the cushions move and bend. But one of the things that is often injured in a patient, a Department of Labor patient, are the joints of the back. And we understand more about this now than we did many, many years ago. In the back, and all the way from the neck, all the way down the back, there are little joints, one on top of the other, one on each side. They're called facet joints. They're like little finger joints allowing you to bend and move. And on the model here, you can see it bending and moving, and the joints moving and so on. And those joints can be injured, and often are injured, in a work-related accident. People talk a lot about the discs being injured, but the joints actually are more common, much more common than disc injuries. And muscle and joint go together because the muscles are over the joints, attached to the joints. So muscle and joint injuries, back strain injuries, you're often dealing with facet pain also. Now, facet pain is something we've known about for a long time, and it's treated all over. It's a very common injury, and there's a lot of treatment focused on joint pain. But one of the challenges with it, at least in my mind, was the treatments offered were temporary. One of the treatments offered for chronic facet pain is something called radiofrequency. And radiofrequency has been around a long time, and it works very well, actually. We did that here for a period of time. It's very, very effective. The idea behind radiofrequency is the joints in the back are painful, and there are little nerves that go to the joint. And radiofrequency is a probe that goes down, burns those nerves so that they're no longer painful. The joint is no longer painful. Those nerves are no longer irritated, and the pain goes away. And as I said, it's very effective. I had a problem with it as a surgeon because what would happen is it's temporary. It lasts 6 months, maybe 18 months. And you have to redo it. So you're constantly redoing it. Surgeons don't like redoing things, at least not my training. They like to fix it, and patients are better, and then they go on with their life. So I looked into this a little bit with my colleague, Dr. Grisalis, about a way to make the treatment more permanent, so patients don't have to come back again and again. So with radiofrequency, you're burning these little micro nerves, and a little bit of an anatomy lesson here. Nerves are like wires that you'd have in the wall. They have an outer coating of rubber and the inner wire. Well, nerves are similar. When you burn a nerve with radiofrequency, you're burning the wire part of it, but the outer rubber, so to speak, that covers the wire remains intact. So you burn it, the nerve is burned, but the outer covering, the perineurium is what it's called, remains intact. And then over time, 6 months, 18 months, something like that, the nerve will regrow, the pain returns, and you're back to radiofrequency, burning it again and again and again. We decided that wasn't a good idea. We wanted to try to do something long-term, so we worked on some ideas and some things that have been around before, and we perfected some of the techniques, and we use a laser procedure. The laser is important as a tool. It's not the laser per se. People are like, oh my goodness, laser, that's wonderful, laser, fantastic. The laser it's a hot knife, and what you're doing is you're transecting the little micro painful nerves. You're sort of removing them. And because of that, you're taking off the perineurium, you're taking off the little nerve, you're taking it all out, so the two ends no longer are touching, and they no longer meet and regrow, so the pain relief tends to be much, much longer and often permanent. It is something that the Department of Labor, fortunately, they authorize. Not all insurance companies authorize, but the Department of Labor does. It's called a minimally invasive laser-assisted nerve transection. So basically, you're using a laser to transect these little micro nerves. Rather than burn them, you remove little pieces of it, and then the pain goes away long term. That's something you can do in the low back. It's becoming more common now. People are doing it more in the low back. I've seen some of my colleagues starting to work with it. We do that in the mid back and even in the neck, and develop some instruments that you can use for those specific techniques. Very successful, one of the most successful things we've ever developed here. It actually has decreased the number of larger surgeries that I do significantly, because they're no longer needed, because you can do something much smaller in order to get our patients better and get them back to work. It's outpatient. You are sedated, outpatient, go home the same day. Usually people are back to work. In my hands, usually a few days, but certainly within a couple of weeks, they're back to their life. Very, very effective. It's something we do here for our Department of Labor patients, and happy to evaluate anyone and see if they're a candidate for it. And surprisingly, or maybe not surprisingly, depending on how you look at it, it is something that is authorized by the Department of Labor, and so we're very happy that they're on the forefront of this. They may not be on the forefront of other things, but they are on the forefront of this one. So we're happy to treat our Department of Labor patients with this if indeed they'll benefit from it. This is Dr. Robert Nucci for Nucci Medical.